Few years ago, my aunt started experiencing some unusual changes to her skin. At first, she thought it was just dryness or a reaction to a new skincare product, but as time went on, the symptoms became more pronounced. Her skin became itchy, discolored, and rough to the touch, and she started to develop strange patches that wouldn't go away. Despite trying various creams and treatments, the condition persisted, and my aunt began to feel frustrated and embarrassed by the changes to her appearance. It wasn't until a routine checkup with her doctor that she finally got some answers. After some blood tests and further examination, she was diagnosed with type 2 diabetes, a condition that can often manifest itself through changes to the skin. The diagnosis was a shock to my aunt and our entire family. We knew very little about diabetes and the ways in which it could impact a person's health. But as we began to educate ourselves, we realized just how common this disease is, affecting millions of people around the world. Although some skin changes are seen in later stages of diabetes, few are typically seen in the early stages. However, some skin lesions are general and can occur in anyone, but people with diabetes get them more easily. In this video, we'll discuss some of the skin changes that can occur in people with diabetes so that you can be aware of the signs and take action if necessary. One skin change that could be a sign of high blood glucose level is a dark patch or a band of velvety skin on the back of your neck, armpit, or groin areas. This skin condition is called acanthosis nigricans and is commonly seen in obese people. It may be the first sign that someone has diabetes. If you notice this type of skin change, it's important to consult your doctor, as early detection of diabetes can prevent future complications. Another skin change that could be a sign of high blood glucose level is numerous skin tags with blackish discoloration of skin, most commonly on the eyelids, neck, armpit, and groin region. While few skin tags or skin growths are normal and harmless, numerous skin tags with discoloration could be a sign of high blood glucose level. You may also see yellow, reddish, or brown patches on your skin. This skin condition often begins as small, raised, solid bumps that look like a pimple. As it progresses, these bumps turn into patches of swollen and hard skin with a shiny porcelain-like appearance. You may also notice blood vessels, and the skin may be itchy and painful. This skin condition is called necrobiosis lipoidica and is common in people with diabetes. About 1/3 of people with type 1 diabetes have digital sclerosis, a thick, tight, waxy skin that develops on the back of the hands. The finger joints stiffen and become difficult to move. Sometimes this skin problem occurs on the toes and forehead as well, and rarely the knees, ankles, or elbows may stiffen. Control of blood glucose level and physical therapy may be helpful in this situation, and using a moisturizer can help to soften the skin. Diabetic dermopathy is a skin condition that causes spots that create a barely noticeable depression in the skin. It's common in people who have diabetes and usually forms on the shins, though in rare cases, you may see it on the arms, thighs, trunk, or other areas of the body. The spot doesn't cause any symptoms, and for these reasons, many people mistake them for age spots. Unlike age spots, however, these spots and lines usually start to fade after 18 to 24 months, but can also stay on the skin indefinitely. People with diabetes can also see blisters suddenly appearing on their skin, which tend to form on the hands, feet, legs, or forearms, and look like the blisters that appear after a serious burn. However, unlike the blisters that develop after a burn, these blisters are not painful. Eruptive xanthomatosis is commonly seen in uncontrolled diabetes and can be treated if diabetes is controlled. Yellow bumps that often look like pimples, but soon develop a yellowish color, can form anywhere, usually on the buttocks, thighs, crooks of the elbow, or backs of the knees. They are usually tender and itchy, but disappear promptly when diabetes is well controlled. This skin condition is called eruptive xanthomatosis. People with diabetes tend to get frequent skin infections, which could be bacterial or fungal. Bacterial infections commonly seen in diabetes are styes, which are infections of the glands of the eyelid, folliculitis, or infection of the hair follicle. Another common skin condition that people with diabetes may experience is xerosis, or dry skin. This occurs when the skin loses its natural oils and moisture, leading to flaky, itchy, and rough skin. People with diabetes are particularly prone to dry skin, especially in their lower legs, because high blood sugar levels can damage nerves and blood vessels. This damage can reduce the skin's ability to retain moisture, leading to dryness and itchiness. To prevent dry skin, people with diabetes should try to keep their blood sugar levels under control and stay hydrated by drinking plenty of water. They should also avoid long hot showers or baths, as these can strip the skin of its natural oils. Instead, they should take short, lukewarm showers or baths and use mild, fragrance-free soap. Moisturizing regularly with a non-greasy lotion or cream can also help keep the skin hydrated. Another common skin condition that can affect people with diabetes is pruritus, or severe itching. Itching can occur in any part of the body, but it is often more pronounced in the lower legs, hands, and feet. People with diabetes who experience itching should avoid scratching, as this can break the skin and increase the risk of infection. Instead, they should try to identify the underlying cause of their itching and treat it accordingly. This may involve using a moisturizer, avoiding irritants, or taking antihistamines. People with diabetes are also at risk of developing skin infections, particularly bacterial and fungal infections. Bacterial infections can cause conditions such as folliculitis, carbuncles, and styes, while fungal infections can cause ringworm, jock itch, and vaginal yeast infections. People with diabetes are more susceptible to these infections because high blood sugar levels can weaken the immune system and impair the skin's ability to fight off infection. To prevent skin infections, people with diabetes should practice good hygiene and avoid sharing personal items such as towels or razors. They should also keep their skin clean and dry, particularly in areas where skin folds or rubs together. It's important to seek medical treatment if an infection does develop, as untreated infections can lead to serious complications. People with diabetes may also be prone to diabetic dermopathy, which causes small, round, and light brown patches on the skin. These patches are usually painless and don't require treatment, but they may be a sign of poor blood sugar control. Diabetic dermopathy is more common in older adults with diabetes, and it may be linked to nerve damage or poor circulation. Diabetes can also increase the risk of developing skin cancer. People with diabetes are more likely to develop squamous cell carcinoma, a type of skin cancer that develops in the top layer of the skin. Squamous cell carcinoma can appear as a scaly red patch or as a wart-like growth. It can also develop on areas of the skin that have been exposed to the sun, such as the face, neck, arms, and legs. To reduce the risk of skin cancer, people with diabetes should avoid prolonged sun exposure and protect their skin with sunscreen, hats, and protective clothing. They should also perform regular self-examinations and report any changes or abnormalities to their healthcare provider. If you enjoyed watching this video, please give it a thumbs up. Also, if you have any questions or comments, please leave them below. Subscribe to our channel for more health and wellness tips.